change it. So egg donation process involves a number of very simple discrete steps. It involves taking a group of donor eggs, it could be 6, 10, 14, fertilizing them with sperm, either from a sperm donor or from a partner, creating embryos, and then once you create the embryos, then you simply provide hormones to prime the lining of the womb so that you can put an embryo back into a receptive endometrium. So it's relatively simple processes to achieve a successful pregnancy through the use of donor egg. One of the many questions I get when I'm talking to individuals or couples about the donor egg option is that they're concerned that the egg is sort of, from an individual standpoint, it's not for me, it's someone else's egg. And what I try to emphasize in a very general way is that at the basic level of DNA, we're all fundamentally similar. In other words, if you take the DNA of a cell and you look at it and analyze it, you're not going to find a huge difference between all the various peoples living on the planet. Our DNA is so similar that, of course, we can successfully interbreed. Therefore, the naked DNA is very basic to all of humanity. In fact, it's one of the few things that keeps us together as humans. But above that is a level of control and with what is referred to as epigenetics. And that's the most important part about an individual, is the way in which during fetal development in the uterus, the mother's environment impacts the epigenetic control of the genes that are available from the early stages of embryo development. The other thing is, of course, for successful pregnancy, you need crosstalk between the lining of the womb and the embryo. That's obviously the lining of the womb belongs to the mother. And then eventually the implantation process leading to the development of placenta, then is the communication between the maternal circulation and the fetal circulations. And it is the mother that supplies all the nutrients. It is the mother that supplies the oxygen to the fetus. So the in utero environment is fundamentally important, and the gene regulatory networks are fundamental to the development of the fetus. And of course, they are under the control of the mother. So there's a lot of stuff going on that is maternal in origin, even though at the basic DNA level, it is not the mother's egg. But never underestimate all the other processes. So in couples or individuals who are interested in treatment through the use of donor egg, they will typically go through as a series of, as I say, very discrete, simple steps. You meet with a fertility doctor, the history is reviewed, both the couple's history, either their fertility history. If they then, after much discussion, decide they want to move forward with donor egg, they would then be assigned a donor egg coordinator. I have my favorite donor egg coordinator by the name of Sharon, who I've worked with now for many, many years. We started off with overseas egg donation, and then we shifted to eggs from the London Egg Bank. And we've worked together for so long that we're very much like an old married couple, and we know each other's foibles and weaknesses and eccentricities. And then as part of the process, you will also have a counseling session, because it's very important to understand the regulatory network involved in fertility treatment through the use of donor egg, and the role of the HFEA in having HFEA registered donors so that any children can see through donor egg, can, if they wish, get more information about the egg donor once they reach the age of adulthood. From a clinical standpoint, The steps are relatively simple. It's really a matter of priming the womb hormonally, and this is a two-step process involving natural estrogen and natural progesterone. It's the same order in which when women ovulate naturally, they produce estrogen and then they follow up with progesterone. And so we prime the womb in a very natural way. The eggs from the egg bank, which we refer to as M2 oocytes. So fundamentally, the egg bank stores M2 oocytes. This is a stage of maturation of the egg that is susceptible to fertilization with sperm. And it's the same stage in which when women ovulate naturally, that's the egg that is released in a natural cycle. Once you fertilize the eggs, you then culture the embryos, and then you can select the best embryo for transfer. And then 11 days later, after the transfer, you can do a very simple pregnancy test to see if the treatment's been successful. This is a summary of our success rates over the last 8 years or so. Cumulative pregnancy rates are about 74%. That is, in couples who have, say, 2 or 3 or 4 embryos from frozen eggs, donor eggs, the more embryos you have, the greater the chance of a higher cumulative pregnancy rate, because each created embryo has a certain probability of success. And on the right-hand columns, you can see the overall cumulative rates for the different age groups. One sees a slight drop as women get a little bit older. This is not unique to us. It's also seen worldwide in donor egg programs. We're not quite sure why. It seems to be the cumulative rates seem to be a little bit lower, but it seems each embryo has a slightly lower probability of resulting in a successful pregnancy. But it is an area of active research as to why the rates are slightly different between younger women and slightly older women. This also goes as we've improved our technologies over the years for freezing. That a significant number of patients, over 80%, will have additional embryos, or what are called supernumerary embryos, in storage after their first transfer. And this is where the cumulative pregnancy rates come from, as you thaw the next embryo and put it back. One thing that needs to be emphasized is that at the end of the day, we're dealing with biology. And biology is noisy, it is unpredictable, and sometimes it's frustrating. But as I mentioned earlier, the egg bank stores M2 oocytes. M2 oocytes all look the same under the microscope. That's why they're called M2 oocytes. But the individual viability of M2 oocytes is quite different. And you don't know that till you fertilize the eggs. So a lot of the things we do are, in fact, post-factum rationalizations of outcomes, because we can never predict the outcome. That's why in reproductive medicine, and true of all medicine, we tend to deal in averages, in other words, what you typically might expect, but you're always going to have outlier outcomes which can't be predicted. So these summarize some of the advantages, I think, of going down the donor egg route, if and when couples choose to do so. You have the ability to review the lists available of egg donors. Once a decision is made, it's a fairly quick process to get those eggs fertilized and embryos created. You can choose the timing of when you want to put an embryo back. And all these things can be reassuring, because once you know you've created embryos, you could then choose when you want to undergo an embryo transfer and achieve a pregnancy. Here we see our overall pregnancy rates from a combination of fresh embryo transfers and the backup frozen embryo transfers. As you can see, we slowly improved our success rates over the last 8 years or so. It's very gratifying to be able to look at our success rates year by year. As I mentioned earlier, that we are regulated by the Human Fertilization and Embryology Authority that was created from the Human Fertilization and Embryology Act. And this includes the regulations regarding the use of egg donors and sperm donors. They're sort of regulated in the same way in terms of the children born through the use of generically what we call donor gametes, eggs and sperm. And this is also, as I mentioned earlier, the reason why we recommend fertility counseling for all couples going down this pathway. I've listed here some of the typical features of that we're interested in an egg donor. The age range is 18, adulthood, through to 35. If you look at IVF success rates for women between those ages, they do very well, and therefore there's no reason why donor eggs equally shouldn't do very well during those age ranges. But it's not merely age, it also has to take into consideration the patient's ovarian health, their ovarian reserve, an extensive family medical genetic history to make sure that any offspring would not be at risk for a genetic disease or other congenital birth defect that we can't predict. And in addition, there's extensive screening for infections and transmissible viral infections in particular. And you can see that the majority of the egg donors are college graduates, and some are 70% postgraduates and so on. So these are very smart, well-informed egg donors. And most of the stats on what drives a woman to donate eggs is really driven by, I think, what I refer to as a sense of sisterhood in trying to help other women who perhaps don't have eggs. And that's the overwhelming reason for women choosing to become egg donors. The family experience with someone else going through fertility treatment might be another driving factor. And then there are some women who know that they have eggs, but also feel that they'll never use them, and therefore they're willing to donate them. They certainly make up the bulk of the groups of women who choose to become egg donors. This summarizes in more detail the screening that's done on all prospective egg donors, included in the 3-generational family medical history, genetic history. And of course, we keep records and include in the database education, work history, interests, and many of the patients, as you'll see shortly, write personal statements on what's driving them to become egg donors. All potential egg donors have to be seen by an egg donor coordinator and a clinician. There has to be a thorough history, also an assessment of the pelvic organs, the ovarian volume, and also blood tests, so on, that are required, both from a regulatory standpoint and from a clinical standpoint. And this represents one level of the tier, if you will, if you go to the website, and you can get sort of general information on a typical egg donor. You get into more depth information on individual egg donors once the decision is made to proceed with treatment through the use of the resources of the London Egg Bank. So once again, it's a relatively simple process to make a selection. I say all this would be done working with a donor egg coordinator. And it's a matter of going to the website. And when you go to the website and you're reading about individual donors, that might prompt some questions, and then you would share those with the donor egg coordinator, and then working together, you would come up with a decision that everybody's comfortable with. Clearly, there's a difference between, say, a young woman in her 20s who it's planned ultimately to have, say, 3 children over the coming years, and say a couple in their mid-40s who perhaps are interested in having 1 child, because the number of eggs for a successful outcome is going to determine ultimately the number of eggs chosen to work with. And so it's up to the couple to have a discussion about their own aspirations before they commit. It shows this in a more extensive profile now that you'll typically see when you register with the egg bank, in terms of the screening tests that have been done, the genetic tests, information about the donor, and physical characteristics. At some point, I think we will be having allowing pictures of donors, but that's a point of discussion in the UK right now. And this covers some of the pen sketches that women are provided in terms of what's driving them to donate eggs. They're all quite a most interesting read as to what the drive is, but you can get a good idea. Certainly, when I meet with egg donors, you can get a good idea what's driving them from their comments in the paperwork that they fill in, that I review before I make recommendations regarding egg donation. So this summarizes what could be found overall on the database, egg bank database. The egg bank database is changing constantly as eggs are used by some couples, in new egg donors produce eggs which they upload then onto the website. So it's an area that's always in flux. I had mentioned earlier that in the field of reproductive medicine and medicine in general, that we always talk about averages. And this is what you would expect if you purchase 6 eggs. And this might be a reasonable decision for a couple who perhaps are interested in a single pregnancy. For couples who might be interested in having a genetic sibling down the road and therefore would like to freeze more embryos, then they would need to start off with more eggs. But I say these are typical averages, but sometimes we get pleasantly surprised where a couple choose 10 eggs and they end up with 6 blastocysts. But if the average is 3, then that means that someone did less well. And of course, that's always a bit of a gut-wrenching experience when we don't get the expected outcomes. But the egg bank does have specific plans in place to assist couples who unfortunately have a disappointing outcome. The other program that the egg bank offers is what is called a 2-cycle pack, and this is restricted to London. But I will ask Martha to talk a little bit about the 2-cycle pack and also an offer that we have for couples who want to make schedule an appointment at one of our clinics.
Thank you, Mr. Summers. So, in regards to 2-cycle package, this is at the moment the offer that we only is available to our patients coming to our London clinics for the treatment. And the advantage of this is that we are giving you a guarantee of a live birth. So it works like this, that you are matched firstly with one donor. However, we are controlling which donor it is. We have like a selection of donors with a proven outcomes from the previous cycle. We have like a scientist that is working with us, and she's like curating the list of those donors. It doesn't mean the donors available normally through our like donor database are less good, but with these donors, we sort of know a little bit the outcomes because they donated or a couple of times, or we already have results from frozen eggs that we still have currently in stock. So it's a little bit like adding that. And if you will be, so you are getting these allocations of one donor, and all the transfer also included in this package. And if you are not successful with the first donor, then straight away you are matched with the second donor. And again, all the transfer are included. And the package is finishing once you have a live birth. If we fail to deliver, then you're receiving 50% off from this package. So perhaps, Mr. Summers, we can go to the next slide. So there are some, like I mentioned, benefits, unlimited embryo transfer, fresh or frozen, depends what you're wishing. There are some conditions on it in who could be accepted or not. So there's an age restrictions from the recipient, and it's all subject to the medical review. So the doctor on the initial consultations will let you know if you are eligible. In general, it will be that you didn't have like a multiple failure previously with the egg donations. There are no problems with cavity, and also that there is a normal sperm parameters with your partner. Of course, if you're using donor sperm, then it's no problem. And yes, and the cost of the package is £20,000, which is a good options considering the price of one full package will be around 11,000, I think 750. So it is like cost effective for those patients that they would like to have this extra guarantee, and they obviously match the selection criteria we have here. If you will have any more questions about that, usually doctors, they discuss this more during their consultations. We have on the website a dedicated page about the cycle package, so you can find extra information there. Yes, and this is just the next step. So if any of you are interested in going into consultations and you would like to start a journey with us using our egg donors and also going through the treatment. And yes, we have today a little discount also for those of you who will sign up. There's about 25% off the cost of all initial consultations. My colleague Annabelle will be emailing all of you participating today, offering this, and it will be valid for a couple of days. Yes, thank you, Mr. Summers. That's the cost of this package. Obviously, if you would like to go ahead and start the process wherever you are in the process. And previous slides was regarding the cost of eggs. So at the moment we have two batches of eggs that we offer. Is batch of minimum 6 and minimum 10. As Mr. Summers said, it depends also what sort of guarantee you want to have, or how many children you are thinking about the sibling, yes or not. So based on this, you can make this decision. We are very transparent with our prices. Everything is available on our website. There are no hidden fees. Everything is clearly written there. Under the cost page on the website, you have full cost of the treatment with 6X or with the 10X. And obviously, if there will be individual situations that you need to have any specific bloods because of your medical conditions or your partner, it's not included then. But apart from that, everything is there minus the medications. So thank you so much. I think that's the last. Do we have any more slides? I don't think so. So we can go into the, because I can see, Mr. Summers, that there are already some questions from our lovely audience. So the first lady is asking if someone with cystic fibrosis gene carriers is allowed to donate eggs.
You want to answer that, or shall I answer that?
Please. Thank you. Well, the answer is yes.
Do you mean that if the patient is if the patient has cystic fibrosis, or is a carrier of cystic fibrosis?
No, the patient is asking that is donor allowed who is a carrier of cystic fibrosis to donate eggs?
Oh yeah. We generally screen for the more common genetic conditions that you'll find in the European, Mediterranean, African, and Asian population. That includes cystic fibrosis, spinal muscular atrophy, the thalassemias, and so on. And we all carry mutations. It's estimated that the average human carries at least 4 mutations in common genes. So we don't discriminate against carriers of the common genetic diseases, but this is all included on our website so that couples can then be informed about which of the donors are carriers. But equally, there is what we offer is testing of the male partner to make sure that the male partner is not a carrier of the same genetic conditions, so that the background risk overall for having a child with a particular genetic disease is quite low, even though the donor actually carries an identified mutation in one of her genes. So we have lots. Obviously we have donors who fulfill the background rate of carrying a cystic fibrosis gene mutation, which is about 1 in 15. So it's quite common amongst the white European population. So we wouldn't discriminate on that basis because they don't actually have the disease.
Yeah, and also we're doing quite sensitive tests, because I remember, Mr. Summers, when we were doing like normal Lumina panel, we didn't have that many carriers, and then when the same donors were sometimes coming back, with this sensitive test that we were doing, it's like it shows double number of carriers, because I think now we are going to like whole gene, and it's like double number of mutations that we are doing. But I don't think that the patients are told about this, because if they go to like a UK clinics, most clinics will do like a basic panel, which is 139 mutations, and most our patients will be excluded from this. But when you do the test that we do in overseas laboratories, it's very, very like sensitive. So therefore we have that many carriers, because like you said, it's 1 in 15. It's actually quite like, and we don't know. I never tested myself for cystic fibrosis. I might be a carrier, I don't know. I hope we answered the question. I didn't catch the cost of the cycle package. It's £20,000, everything included. Obviously not the medications, HCP, everything is on our website if you're interested in our packages, please. Another questions. I know with sperm donors, there is a limit to the number of families that can be created from the donor. Is the similar legislation in place with egg donation? Yes, it's the same. It's the same rule. So a lot of like, generally it's like a gamete donation. So you will have the same regulation in terms of parental rights, family, and now storage, only now, before wasn't, for sperm and egg donors. So the same, we have 10 families. but we haven't reached yet 10 families with our donors. But we, yeah, it depends on the number of, I guess, cycles one person would like to do. We are allowing donors to do up to 5 cycles. But I think, do you have, Mrs. Summers, anyone in Bristol or Cardiff that did 5 cycles? Do you have any donor? We have in London.
Yeah, I mean, we've got a few.
You got a few,
but
yeah.
Generally, most donors will do 3 cycles, and then they say I might reconsider next year or something like that. But I think most donors will do about 3 cycles initially. But I've had some who've come back and done a 4th cycle when they did 3, 4 years ago. So
okay, it depends. Because also, it's the big range of ages, and we never know if they're gonna come back or not. Although we also don't know, like they might go to another center and do it as well. There is like a central registry called Prism, so always we double check all the available slots. So we will contact the registry and per donor. So this is a good system that is in UK that is very transparent, because we always will know if the donor donated at any other center. So that's kind of safe. The next question is it the best to choose someone with the same ethnicity as a donor?
I think that is entirely a personal choice.
Yeah. But medically, clinical
there's no medical reason why one can't, because they say there are lots and lots of marriages where the couple have completely different ethnic origins. So I think it comes down to personal choice. There are, obviously, in a free society, there are no restrictions like that. We're not regulated on those things.
No.
So it really is down to the couple's own thoughts and aspirations as to the type of donor that they might choose.
Yes, yeah. And we have even sometimes like South Asian patients choosing Mediterranean donors because maybe they're particularly like fair-skinned, or so it's not like it depends on the patients how they feel and how they want the child sort of like to resemble them. I could not find Southeast Asian donor on the website. So majority of our donors on the website will be Caucasians, is true, because this is what we have in the populations. However, we have quite a lot of Asian donors, South Asian, East Asians, but it works a little bit like this with us, that once a week we are adding new profiles on the website. And normally our patients knows which day it is, because we alert them. We have like a database and like the mailing list, and they go on the website and they kind of like take like especially like North Indian donors, or particular like Japanese or Koreans, and they will go very quickly within a day. So we do have, and if you see on all our cycles how many % allocations we have, we will have more than 20% allocations of South Asian, but they might not stay on the website as much as the Caucasian. So if you're really interested, please don't worry, I can really reassure you. We have a lot of donors going through the pipeline, and Mr. Samek can confirm, because we are reviewing on our clinical meetings, and different ethnicity keep coming all the time, and especially in London, I think maybe more than in Wales, because it's such a multicultural and ethnic city. Do you get many donors from East Asian background? I've been checking on the online database and haven't noticed any new come through. Since when you were checking? Because actually we have like a special East Asian campaigns. and we have sort of like a team, East Asian team here in the clinic. So we do have, I wouldn't say like a lot, but we definitely have every month coming collections from East Asian patients, and they're coming to our database. So if you would like to be notified, we can add you to our like mailing list, and then you would know when there is upload. And we always say what sort of ethnicity donors will be uploaded. Another question, but I don't know to what it is referring to. Are these tests done via blood test? I guess maybe this was like genetic tests. Because the only test we were discussing this SMS were genetics for cystic fibrosis, no?
Yeah, yeah. No.
Well, you can do them by blood or saliva. As far as I know, it doesn't matter, it's a gene. But I don't know if you want to elaborate on them.
No, not quite sure what we're.
We doing blood. All tests that we do will be blood here in the clinic because they will be more accurate. But so we take the blood sample and we send them to Spanish laboratory that we use. This quite specialized genetic laboratory. And yeah, for donors, we will be doing variety of different tests. Again, you have all the list on the website. We have like a page about our donors and how they are screened. And yeah, and some urine tests, obviously, chlamydia, gonorrhea, trichomonas, but the rest of the tests will be all just the blood tests. We're not doing like the swab test, like this DNA kit test or something. Those are like a proper test done by the laboratories. Would blastocyst pregnancy rates increase with the use of donor sperm with donor eggs?
I think.
But it depends how wet is the sperm, no?
Yeah, that's a difficult question to. We don't know enough about sperm really to. As long as sperm are vital and moving and are normal shaped, it's reasonable to assume that they are viable. And really, at the end of the day, it revolves around the viability of the egg more than sperm. There are some cases where there's a suspicion that it might be the sperm, but it really is the egg, which is the most delicate component of the IVF process. And so you can, but in general, with eggs and sperm, when you put them together, you can expect on average about 50% of the fertilized eggs to make it to a blastocyst.
Yeah, thank you. So I would say, because I'm getting again this question about this bloods and genetic tests, I think I understand it a little bit more. So for donors, we only do the blood tests. However, if there is a recipient that doesn't want to come to the clinic, we can send like the saliva kit. So laboratory will send directly to you like a kit that with the instructions how to take it, and then you send it because it's prepaid. The courier will come to collect it and it will go straight to the laboratory. I hope that's now covered that. So on Asian donors, do you also proactively ask highly demand donors to donate again? Oh, we do. When we have a very good donor, we would always ask, but you know, it's something we cannot like expect. We will always ask, especially sometimes patients asking for the sibling use, or if there was like a very particularly good outcome for donor, we might say that it performs so well, would you consider to donate again? But at the end of the day, it's their wish, it's the gesture that they are doing, and they are not obliged to do anything. But generally donors are so lovely and they just want to help. So if they could, they always will come and donate again. But it depends on their circumstances as well, how they are doing it, how busy they are, with study and different things. So it's really hard to say, but we are. And Mr. Summers, you're doing like follow-ups after. So if you will see like particularly good donor, you might mention this and say that, yeah, she's a good candidate to donate. So I have to pose adjuvant breast cancer hormone therapy for IVF, so have a limited window for conception and pregnancy. How quick can the process be from initial consultation?
Oh, I think that really you can get set up for selection, fertilization, and be in a position to put an embryo back over about 4 to 6 weeks. Something like that. If someone's got a specific reason for wanting to expedite the process, I think you can organize it. You can get your ducks in a row quite efficiently in a very stepwise way. Purchase the eggs, fertilize the eggs, create the embryos, and put an embryo back over. Yeah, I would say 4 to 6 weeks.
Yeah. Yeah, no. And also when we know the situations like you have, we would try our best to speed up everything for you. Of course, you need to be like knowing what kind of donor you want, and then, but everything on our side will be super fast. And is the clinic experience in treating people in my situation? Thank you. So people who are like that lady. Mr. Summers, are we experienced in treating ladies like that they need to pause the cancer treatments?
Well, a lot depends on. You have to work with the medical oncologist in terms of clarifying what is permissible and what is not permissible, depending on the medical status of the patient. But in general, if you could probably get the treatment done more efficiently through London than through one of our outlying clinics, because of the paperwork that's required in shipping of eggs from distant clinics. So,
but yeah, we can arrange everywhere, but in London, because of this, the bulk of the donors are there in recruitment, so it's just easier. And we do in London have cases like that we have patients with current oncological treatments post and going through the treatment. And we also do quite a lot of egg freezing for patients like that, not only egg freezing actually for oncological use, like is quite popular. Popular. It's like we see more and more patients coming to us with this. So definitely that won't be a problem. But like Mr. Summers said, obviously we will need to have some letters from your oncologist to understand where you are and what kind of, and give you sort of a treatment plan to follow up with them. And the last questions we have actually, do you have live birth rates? So we generally say the live birth rate will be like 8%, 10 down from the clinical pregnancy rates, no? What would you say, Mr. Summers? Let me have a look if what was our last published live birth rate. So our cumulative live birth rates exceeded 60%. So the last study that we did, that Vanessa did, it was from 559 consecutive recipients of frozen toad eggs, 2017, 2019, and we had a cumulative live birth for patients 60%. But it's really hard because it all depends. So we are saying that if our cumulative pregnancy rate is about 70% after 2 embryo transfers, we will always note that about 10% of these pregnancies will not lead to successful deliveries. So this sort of will be like around 60%. It's just sometimes like also hard for us to get the outcomes because we ship embryos to other clinics, we ship embryos abroad. We have a lot of like recipients coming from all over the world. And it's just obviously it's the requirement that the recipients give us outcomes, but it's not always happening. And we are like chasing quite a lot. That's why. But in general, I would say it's 10% less than clinical pregnancy rate. I think we don't have any more questions. So thank you so much for everybody who joined us tonight. Thank you so much, Mr. Summers, for such a comprehensive seminar. And like I said, we will be contacting you tomorrow with this offer of initial consultations. And if you will have any more questions, please email us. We can pass also some questions to Mr. Summers, or if it's about the packages or the prices, we will be more than happy to answer everything. Thank you, and have a lovely evening. Bye.